So this is my update as I'm going from basically week 4 into week 5. And so far things have been pretty good, but I tell you, about the last 3 or 4 days, I've had this cramp in my calf, in my left leg, and I felt like it was like too deep to be like a muscle soreness of some kind. And I went in and I thought maybe it was a side effect from one of the um, medications that supports the body's ability to reduce the likelihood of having rejection to my kidney transplant. And that can cause muscle cramps and even issues with bone marrow and circulation. So there's a lot of factors. But I kept thinking, like, I hope this isn't a blood clot or something. And about 3 weeks ago, I felt something like that in the back of my calf in the same spot, but it was small. And it was only laying for like a couple hours and it was gone. But now this lasted like 3 or 4 days. And so I noticed when I'm sitting down, I have my leg up, I'm fine. Like, my body just relaxes and it's great. And as soon as I stand up and start walking around, this excruciating pain just starts throbbing and throbbing and throbbing. And it didn't feel warm or anything like that, but I told my doctor, one of my doctors this morning at my like 6 o'clock appointment in the morning, and they said, well, let's have an ultrasound just to make sure we're not missing anything. So they found a blood clot. Your boy couldn't quite get through this without having something to deal with. I haven't had any pain meds or anything. And all of a sudden now there's a blood clot. One of the things I know they want you to do is to stay active. Well, I've been sneaking, working out, not heavily, just like 10 pounds. Like, I normally lift 100 something, 200 pounds, depending on what it is. And all of a sudden I'm like, let me just do something to keep the blood flowing, and use an elliptical, non-weight bearing, things that I know as a former trainer and athlete I could do that wouldn't cause any strain or stress to my body. And I'm talking like 10, 15 minutes. So when I asked them, like, what do they think caused this thing? They're like, well, usually it comes when people are sedentary. I was like, I've been going to the gym, right? And they were like, you have? I was like, yeah, from day 8. And I'm not supposed to, but I go when nobody's there. I wear my mask and, salute everybody and just keep rolling. But there's like literally like 10 people there, if that, and I'm not around anybody. So I'm doing everything that I know I'm supposed to do. But sometimes the good Lord just allows you to go through things, and as long as we get through it, what difference does it make, right? So I was planning on coming back to work in another week, about a week or so, and now they want to monitor me for another week. So I'm gonna have to push things back a little bit, but it is what it is. Sometimes you just got to take care of yourself so you can be more present for other people. But I still appreciate all the calls and texts and all that. I haven't always been able to get to everybody because I still have to tend to my daughter and support her and do all those things that you still have to do as a parent, as my wife commutes for work. So forgive me if I haven't gotten back to you right away, but it is my intention to do so when I can. But feel free to keep reaching out if I come across your mind. Prayer is always appreciated. But that's what it is. So taking medication again for something else, but at the end of the day, I'm still above ground, and I'm thankful. No matter what you go through, we must stay thankful. I will not allow my circumstances to define how I feel about myself or my situation, and I hope you do the same. So anyway, many blessings to you. This is my 3rd trip to the hospital, 2 different hospitals on the same day, UCLA and now Kaiser, in Woodland Hills, and so it's what it is. So anyway, keep me in your prayers, take care of yourself too, and I'll talk soon.